Hi, folks. This is Dr. Rex Gatto, a business psychologist and cognitive behavioral psychotherapist. I've completed a series of new webinars for nurses and physicians to help address stress of the job. The webinars are for all medical providers in general, but especially for those working in the ICU and COVID floors. This particular webinar provides insight into the skills to enhance motivation, inspire, and develop you. It will help nurses and physicians and medical leaders to create an environment that motivates and supports all medical staff, that is, physicians, APPs, and nurses. I look into demotivation through negative thoughts and start with a case study, identify what it is that you want, and then help you to develop a plan. Let's start with a case study. Sharon, a 30-year-old intensivist who has been working with critically ill patients for the last 8 years at Mount A Hospital. Joe and Mary are ICU nurses who usually work with Dr. Sharon. The three of them have been working very closely during the COVID pandemic. The work environment has become more stressful. They work long hours, come home very stressed, and find that they have little energy. They've discussed how they have no social life and don't even see friends because of the COVID. They say that it's just hard and just heard about another unit that has had to close because a nurse and 2 physicians tested positive for COVID. Each of them tells how they feel as though the walls are closing in. They discuss very sick patients under their care, losing patients, and worrying about their families, trying to make a difference, working long hours, and being understaffed at the hospital. Does any of this sound familiar? And what do you do as a leader and a caregiver? Demotivating negative thoughts. Listen to that study that I just went through with you. And someone may think, do I even want to come back tomorrow? Am I making a difference? People are dying. How much more can I personally take? Not just the position, but me as a human being. Regardless that I'm a physician, a nurse, an APP, it doesn't matter. I'm a person. I'm a human being with human emotions. Why am I doing this to myself? I'm exhausted, angry, and emotionally depleted. If these thoughts are thoughts that you have, maybe we should have a discussion. So I'd like to have a discussion with Nurse Mary, and the two of us will go through some ways to really hone in on specific thoughts. Me to Mary. Mary, why do you feel depleted? Because I try to help patients, but it just doesn't seem to work. Mary, why doesn't it work? There are very sick people. And when they come to the ICU, they are very sick. And I try to help them, but they are dying, young and old. Why are they coming to the ICU? Because these patients are very sick. They cannot be cared for on the acute floor. And the hospital has sent them to the ICU. Intensivists are working with them. Why is working in the ICU so stressful? It's a hectic place. We're understaffed. We have very sick people that we're trying to help and save. And COVID is not helping. When patients get better, how do you feel? I feel very happy and I want to scream, yes, and celebrate with the patients and their families. But we really can't. When a patient dies, how do you feel? I know patients who come to the ICU are very sick. But there are so many patients dying now. We do our best in caring for these patients, but we just can't save the patients that are coming to the ICU who are so sick. What's your job in the ICU? To care for patients. Are you caring for all the patients to the best of your ability? Absolutely. But I'm still frustrated I'm very stressed. Workload is hard. We're understaffed. And to be honest, I'm absolutely depleted. Ladies and gentlemen, if any of this sounds or relates to you, let's talk a little bit about this and then ways to overcome some of this thinking. Do you relate to Mary's pain and frustration? The debrief. If everything in the ICU changed for the absolute better, describe it. It might be something that you'd want to talk about just for yourself. If we could change the ICU for the better, what would it be like? If you were not stressed working in the ICU, describe how you would act. If you were not exhausted at the end of the day, what would you be doing? Those are 3 questions that I suggest that you address and work through. Things do not change and you are stressed, but I want you to start asking yourself some questions to think in a different and expanded way. If I asked you the question, what is it you want? I listed a number of thoughts that I would want: happiness, fulfillment and satisfaction from my job, to be recognized as a professional caregiver, to be stressful but saving lives, and successful in saving lives, to meet my own professional and personal goals, to be treated with respect, be a role model, live without all the worry, stop the ruminating negative thoughts, and to achieve success. You notice above I said stressful and saving as well as successful and saving. We cannot live in stress-free lives. We can't do it. But we can focus on lessening stress and creating happiness and focusing on what it is that we can do. Happiness is that feeling that we all have in life. There are special days in our lives that we have good feelings and feeling of happiness. Maybe it's a birthday or a special event or a graduation. Why is it that we feel happy? What are the thoughts that we have that create happiness? What needs to occur to achieve happiness working in an ICU or acute floor or in the OR or working in a general practice? What are the things that you would need to do to feel a sense of happiness, a reward for yourself? That sense of well-being, joy, a contentment when people are successful and safe and they feel happy. You know, no one ever complains about feeling too happy. I felt too content. I felt too good. It's when we have the stress of pain that we begin to focus in a new and different way. That contentment of doing the work. Why do you feel contentment? Why don't you feel contentment? The feeling that you really have to feel fulfilled. Personality. Does your personality play a role in your happiness? You know, personalities under stress really can play havoc. They can create doom and gloom. Personalities that are happy create doom and gloom under great stress. Or people who are almost unemotional become very angry. And that's because the personality is under stress. Accept your successes and achievement. Give yourself credit for what you do accomplish. What have you really acquired in your life that you want? Status, cars, house, family, community. These are all very concrete signs of success. But do they bring happiness? Are you doing the work and activities that give you happiness? You know, years of study to be a medical caregiver, regardless of your title, took a lot of hard work. Are you giving yourself credit for all that you have accomplished and the choices that you've made to really show the achievement and give yourself credit for that achievement? Think about who you are and what you have achieved. It should be a form of happiness. A sense of fulfillment based on your thoughts. And what are your thoughts? And we're going to talk about that. Interpreting your work as successful. What is your ultimate goal in work? Challenge the negative naysaying ruminations, those thoughts that spin and spiral down on you. Realizing success and failure and loss are points of learning. One of the greatest losses we have is analyzing our successes. What are we doing right to cause success? We spend so much time analyzing failure and loss, but we don't spend the equal amount of time focusing on success. Learn about yourself. Learn about your stamina, your strength in caring for others, your compassion and passion for the success of your job. At the end of the day, complete the following sentences. I would love to see what you have to say. Today, I accomplished. I feel really good about. I'm frustrated by. I'm comforted by. Tomorrow, I will. Imagine if you completed each one of these sentences and kept a journal of day to day to day to day. And I might even encourage you to share these with others, either a family member or a trusted peer. Debriefing your thoughts for a better you can be very helpful. Today, I will accept my successes and my failures, but my successes first. I acknowledge the pain that I am feeling. It's all right to feel that pain. Accept it. Don't push against it. You are a human being and you have human emotions, and those emotions at times can bring pain. Be flexible, adaptable about change, knowing that as a professional, you're going to do your very best. I will not use today's thinking to evaluate yesterday's decisions. This is something that I say to a lot of the people that I work with, whether it is in therapy or whether I am coaching people, that I want them to understand the decisions that they made a week or a month ago can't be utilized or evaluated based on today's thinking. We learn every day. We grow every day. You did the very best that you could in making a decision at that time. Tomorrow, focus on being resilient and know that as a professional, that you are going to comfort sick and you can comfort each other as well as yourself. Take care of yourself. Face your feelings. Don't just try to suppress them. Accept them. You can feel frustrated and know why. Complete those sentences at the end of the day and honor your feelings. You know, I wish I could almost mandate a 5-minute mandatory debrief at the end of the day with colleagues. This is what we did today. This is how we feel today. No excuses. Just these are the things that occurred today, and almost use it as a debrief. Find ways to relax through physical and mental exercise, music, reading, a warm bath, or meditation. Find ways for yourself. A lot of times I recommend to people that you find 15 minutes in the AM, 15 minutes in the PM, just for you. Find ways to relax, get out of the environment. Even if you went outside for 5 minutes or on a nice day, just walk down the block and back. Find ways to care for yourself. This is a format that I like to use: situation, causes, outcomes, and behavioral actions. Just think of the situations that you're in, the causes, how you can self-care, coach for yourself, and actions that you will take. I've used this same format in other webinars that you may have seen, but just take a look at the situation and define those for yourself. A plan of action. Focus on the positive. Don't listen to the negative, complaining gripers. Practice acts of kindness. That means starting with yourself. And caregiving. That means starting with yourself and then to others. It's just like on the airplane. If we need oxygen, put your oxygen mask on first, then you can help others. The same principle. Be kind to yourself, be caregiving to yourself, then you can care for others. Spend time with the right people that support you, the right people, people with whom you are energized and can energize. Be grateful for what you have and what you've done. Realize every day is a learning experience for you. Here are some resources for you. One is Choosing Happiness, and then a CBT approach, simple ways to increase your own happiness. And ladies and gentlemen, if I can be of help to you, my contact information is on the left. But begin by understanding. I understand the frustration that I am having. I understand the stress that I am having. Care for yourselves to have a better quality of life. And that starts with you finding happiness for yourself.